Welcome to the 513th episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. Welcome and thanks for listening. I'm a couple days late with the podcast. I guess I got kind of tied up with some other things, and nothing quite struck me until the last few days, so I waited till I came up with some good ideas, and here we are. Training updates, doing well. Next event, 50-mile skunk ape in Ocala region of Florida. A little bit of hills, but not much because it is Florida. But it should be hot. And there's about 6 miles of beach sand called a berm that I guess it's like a firewall for forest that we have to run through. So that'll provide some interesting training effects. So trying out, again, strategies, all leading up to the A race in Leadville. So this race is about pace and about run-walk pace for flat areas at Leadville. It's about working my ankle. It's about fueling for 50 miles. Again, honing in on what shoes I like the best. And then come off of this race and do recovery, and then go into the Cruel Jewel, which is a lot of climbing that will simulate the climbing in the Leadville 100, but not with the effects of the altitude. It's a pretty technical race, so it'll be the opportunity to go up and down, twist and turn, so that's good as far as that goes. And then everything is focused on Colorado after that. So far so good. Doing 2 speed sessions a week, adding some hill training sessions. Today I did my usual 3-0 little short run, and then did 45 minutes on a treadmill going uphill. So I started at 6%. Every 5 minutes I increased the grade up to 15%. So I got about 2.5 miles, adjusting for mainly heart rate. So my heart rate was just like I would be if I was running kind of marathon paced effort, but I was just power hiking. So 17, 18 minute miles, whatever I could hang on to keep my heart rate less than 130, but to keep it over 120. So I managed to get 2.5 miles going uphill for that. So all good training. So occasionally I get the opportunity to see a patient that is their own control, what would happen with a particular intervention. And I had the opportunity to observe a patient that I had met some 20 years ago, having his first heart attack at age 50. Back then I was practicing traditional cardiology, so he got a cath, he got stented, he got statin, beta blocker therapy. We changed the practice, and he kind of coaxed him to come along for a while, and he and his wife became plant-based. They lost weight. We got him off of his medication. We normalized his glucose. His wife's autoimmune disease improved, and they kind of left the practice. They didn't see the value. And then I got the opportunity to observe from a distance, and weight back on, blood pressure medicines back on, glucose medicines back on, so now on 6 or 7 medications. So own control. You could say, well, he was aging, but we clearly showed he was better 5 years after his intervention on a plant-based diet, and then has gotten worse, and medicines have been added to his regimen. And I think that's a good way to look at yourself. I know other patients that have been plant-based, and then they've become not plant-based, and things have happened, and they went back plant-based and are feeling good. I observe my family. I have a strong family history of cardiovascular disease. The 2 of us that are plant-based have one lifestyle, and the other cousins have lifestyle diseases. My uncles all had cardiovascular disease and diabetes. My mother, on the other hand, was plant-based and lived to be 90, and lived so well that I had to cancel our golf game the day after she died. So you can observe yourself, your siblings, on and off, check labs, see how you feel. And it's a good way to look into things. There was a recent study passed in Nature Medicine looking at participants over 30 years in the Nurses' Health Study. Now, the Nurses' Health Study is questionnaires, but they looked at the number of people that made it to 70 years of age free of disease, meaning they weren't on medications or had a diagnosis or had intervention. And what they found, over 100,015 participants, 30-year follow-up, only 9.3% made that criteria to get to 70 without a disease. The majority of them, and what was most healthy, was eating a predominantly plant-based diet. Things that didn't work out for the benefit was a paleo-type diet or a high-fat diet. You got some benefit with the Mediterranean diet, some benefit with the DASH diet, which is basically a moderation diet with low sodium to decrease hypertension. But plant-based predominant was very, very beneficial, like we all would expect. And again, in that study, they were not vegan, predominantly plant-based. It was a dietary history, so you don't know how much was whole food. Certainly wasn't low oil, but still had some benefits. So a score for our side. Today, I was brought to attention by a post by a Dr. Tro. He is a family practice doctor who does an online health coaching business. He was a DO and now just does telehealth, but his claim to fame is that he was formerly obese, as was his family, even when he became a doctor, and then he went to be carnivore and he lost a bunch of weight, and so he's teaching everybody to be carnivore. The craziest thing that I've seen him post to date was today: fiber, you do not need 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 fiber. To me, that is malpractice. If we go all the way back, and Dr. Tro looks substantially younger than I am, so I would guess he's in his 40s, and he's been doing this way for several years. I think he might claim 7 years of a carnivore diet. But he may be too young or naive to know about a tumor that was named after a doctor, Dr. Burkitt. Dr. Burkitt had a childhood lymphoma named after him, and Dr. Burkitt had done a lot of work on a missionary trip to Africa, and he was a general surgeon. And what he noticed when he spent years in Africa was that he did not do one appendectomy, he did not do gallbladder surgery, he did not observe diverticular disease, he did not observe colon cancer in his particular area, where they had a substantial high fiber diet, greater than 40 grams, approaching 60 grams a day. He made a joke that he said that you can tell how much fiber a population consumes by the size of their car. So if you go to the parking lot of your nearest hospital and you see fancy cars, you'll know that the people in your area don't eat much fiber. You can find this video. It's actually a YouTube video, and it was done in the 80s, way back when. And he didn't give a mechanism of it, but the people ate a very high fiber diet and did quite well. All the way back in the 80s, this was observed. What we do know is that people eating the standard American diet typically have a tremendous amount of diverticulum, outpouching of the colon. As people get older, they tend to have problems with constipation. When they come into the hospital for other reasons, we see their x-rays, and if it shows the abdomen or they have an abdominal complaint, typically the colon is full of fecal material, sometimes all the way full. It becomes very baggy and distended. Stool softeners are a standard procedure medication in the hospital, along with Tylenol, PRN, aspirin. Everybody gets a stool softener because everybody's constipated. They are not eating a high fiber diet. Typically, an older person is eating a very soft, bland diet: white bread, mashed potatoes, toast, hamburger, processed meats, eggs. Only plants have fiber, animals don't have fiber. What animal products do have is that they're all dead. So the animal was killed and butchered well before it gets into the meat case at your local grocer. So it has been decaying, it's been sprayed with a gas to make it look red and fresh, but it's not. And so when you cook it, the dead piece of meat, and you eat it, it slowly decays throughout your GI tract. And when they look at the gut microbiome of meat eaters versus people that are plant-based, it is very different. The people that eat meat have gut bacteria that are able to ingest decaying meat and substances. There is a chemical that is emitted when the animal protein mixes with this gut microbiome, carnitine, which is a very inflammatory. So people tend to have a very inflamed colon. Because of the slow transit time, the colon becomes very distended. The longer something dead and something that contains toxins and heavy metals sits in your gut, the longer you can absorb what's in that piece of material. So unlike plants, which go through the system very quickly, which haven't been alive near as long as an animal to get to harvest, so plants have less toxins, pesticides, heavy metals, but your animal products do, and you get longer and longer to absorb those. Hemorrhoid surgery is something that is performed by general surgeons quite a bit, again, from pressure in the colon for long periods of time because of the weight of the stool. And when people are cleaned out for their colonoscopies, typically it takes a horrendous bowel prep to get them cleaned out as opposed to a plant-based person. And again, you can be left with a very distended, saggy type colon. So besides fiber in carnivores, vitamin C, it would be another deficiency. So the source of many cancers is an immune function. So it's an immune dysfunction that is involved in the initiation and progression of cancer. And in people eating a carnivore diet, there is a large absence of vitamin C. And it has been said in a lot of people that go into the hospital, they are so immunodepleted and so vitamin C depleted that if you looked at a urine test, they have borderline scurvy as far as the numbers being so low. American Dietetics Association recommends 100 milligrams of vitamin C a day, which is not near enough to support your immune system, especially as you are aging. So when we talked about skin in previous podcasts and collagen, vitamin C plays a big role in that, plays a big role in skin health and development of cancers there, but also cancers throughout the body, colon, lung, and so forth. So people that don't come in contact with fruits and vegetables high in vitamin C, unless they're taking some sort of a giant supplement, are at a very increased risk for cancer because of that too. So not only are meat eaters lacking in fiber, they're also lacking in vitamin C. Humans do not produce vitamin C, but it's known that when we get sick, we need a tremendous amount more of vitamin C. If you look at another mammal that's capable of producing vitamin C, when another animal gets sick or injured, their vitamin C production goes way, way up. But we lost the ability to do that over time. So if you want good gut health, I would suggest you not follow a carnivore diet. They even made comment that little stool was okay, not having a bowel movement was okay, but I'm sure you can find somebody that you know that hasn't had a bowel movement in 4 or 5 days and find out that they're not really that comfortable. So no Dr. Trio, do not avoid the fiber. I used to get referred with people with an abnormal stress test and what to do about it because people got stress tests that shouldn't get stress tests. And now I get referrals for people that have abnormal calcium scores and what should be done about it. And there's finally been an article published in the Journal of American Medical Association saying, wait a minute. Who should really have a calcium score done? Who will it benefit? Who will it make worse? How would actually guide our therapy? Because it is a relatively inexpensive test, unless you multiply it by millions, but it requires some radiation, but not probably 15 or 20 chest X-rays, perhaps. It doesn't require an IV. It doesn't require any kind of sedation, so you can do it on the masses. And so it's a great test if you're an imaging facility or you have a kickback from an imaging facility to do a calcium score. And then you get this calcium score number back, and you have to figure out what to do with it. In a traditional practice, a positive calcium score may lead to CT angiography, which may lead to a heart catheterization and stents in an asymptomatic person. And we know in an asymptomatic person, a stent or a bypass is not going to make them live a day longer and can make them live substantially shorter, because there are complications to these procedures, such as stroke, heart attack, death, and vascular injury. So one might say that if you have traditional risk factors, then for cardiovascular disease, then a calcium score might see whether or not you have coronary disease already or not. So if you have a family history of cardiovascular disease, you have high blood pressure, you smoke, diabetes, high cholesterol, or overweight, you have an increased risk of cardiovascular disease. So should that entire group get a calcium score? Maybe, maybe not. If you're less than 40, chances of it being positive are low, even with risk factors. And again, if it would be positive, one might say, well, that would be a reason to start statin therapy in a young age group. And so that is one of the proponents of, is that, well, we can tell if we should start statin therapy even younger, in individuals younger. But bear in mind, there's never been a study showing asymptomatic people live longer on statin therapies. So now we're going to back up what age you can start a statin, so you have a longer chance to be exposed to the potential risk of statin therapy: myositis, myopathies, neuropathies, and adult onset diabetes, to name a few. Liver abnormalities, and a variety of other side effects potentially, not to mention the cost, not to mention if you were to start these in a woman of childbearing age, on and on and on. And again, there's no data in a young individual for 50 years of statin therapy, never mind the cost. So if a statin doesn't make you live longer, even if you have cardiovascular risk factors, then what does it do to do a calcium score early? Probably not much. If you're the 50-year-old that has diabetes, hypertension, high cholesterol, and is overweight, and you don't want to change your lifestyle, perhaps statin therapy would lower one of your risk factors. But again, it can increase your risk of full-blown diabetes by about 4%. So is that the case? We want to put a calcium score on people? I don't know. If you're over 80, there's a 90% chance that you have coronary artery disease to some extent. And there's probably stable plaque because you made it to 80 years of age, I'm sorry. So in those people, and there's no data on putting those people on a statin. So there's no data putting an older person on statin over 80, not one shred of data. Most likely they have coronary artery disease. Most likely the plaques are stable. There's also an indication that if you're on a statin and you have coronary artery disease, a calcium score might actually get worse over time. And the reason why they say that is that the statin may cause the plaque to stabilize, and therefore the calcium score will go up. So if someone says, I want to get off of statins, and they say, okay, get a calcium score, and it's abnormal, then they're certainly not going to stop the statin, but the chance of it ever normalizing are very low because the statin's going to make it worse over time. The other problem is that they throw runners under the bus, especially endurance athletes that have a positive calcium score, and they say they should be on statin, but they have less events. So if you have a runner that has a positive calcium score and you put them on a statin, there's a good chance you're going to make the calcium score even higher. It was estimated that if you took everybody that has a positive calcium score and a new positive calcium score that you're testing, not the people already on statins, but the people that aren't on statins, that you would increase the use of statins by 44%. 15% would get potentially further invasive interventions. In a Danish study, a calcium score was not associated with a reduction in all-cause death. If you have multiple risk factors for cardiovascular disease and you're over 50, you have a 5 to 7.5 chance of having cardiovascular disease. If you have a positive calcium score, that bumps it up to 7.5 to 10%. If you have a 0 calcium score, you still have about a 1 to 5% risk of cardiovascular disease. It is recommended that you take a statin if your calcium score is over 100, because chances are you may have some cardiovascular disease, but remember the statin is going to increase your calcium score, so you can't really follow it. In a study with 614 patients older than 65, there was a greater than 90% chance of having a calcium score greater than 0. The average was 671. What are you going to do? Again, if you have no symptoms and there's no data for, again, people over 80. Some people are even getting yearly calcium scores, and there's absolutely no data that there's any benefit to getting yearly calcium scores, just like there's no benefit to getting yearly stress tests. What you should do is address your risk factors. So the risk factors for coronary artery disease are high blood pressure, high cholesterol, smoking, being overweight, adult onset diabetes, and a sedentary lifestyle, and a family history. All but a family history can be altered through lifestyle interventions. Only Dr. Tro would tell you to eat more meat if you're over 50 and you have cardiovascular risk factors. So how do you have a healthy colon and a healthy heart at the same time without having a calcium score? Eat a plant-based diet and eat a high-fiber diet. If you go back an episode or two, you can hear Addie talk about the fiber and all its glory and all the different benefits that it has. The best thing of which it is associated with low-calorie dense foods. So the higher fiber diets you eat, the lower caloric density foods you're eating. They typically also have a lot of other good things, such as the ability to make nitric oxide, antioxidants, anti-inflammatories as well. So it's a win-win situation. If you could cure cardiovascular disease with dairy and eggs, we would not have cardiovascular disease in the United States with the amount of eggs consumed and dairy that's consumed. In the form, mainly in dairy, in the form of cheese. People say, no, I don't drink milk much, but it is the form of cheese where it is the highest prevalence. It is estimated that less than 10% of people get adequate exercise. So instead of spending your time waiting in line for your calcium score and your CT scan, you would be much better served going on an hour walk or run. Post-exercise inflammatory markers go down and stay down, which also is a benefit when it comes to colon health, cancer risk, and cardiovascular risk. So we can debate how high your cholesterol or how low your cholesterol needs to be, but in the presence of the flame called inflammation, everything certainly gets worse. So if you're a diabetic, you're overweight, you make inflammatory proteins, you eat an inflammatory diet, you have high cholesterol, you are working on significant vascular disease as well as significant GI distress and disease. Motion is lotion. I hear so many people every week tell me I am worried because people at my age are starting to have this go wrong or that go wrong or this go wrong. And I said, look at them. What are they eating? What are they doing? Don't do what they are doing. Don't do what they're eating. Yet people are afraid to eat and act differently from their peers or their family. Getting a negative test does not mean everything's okay, because clearly a negative test does not give you a clean bill of health for any prolonged period of time, an hour or so. I also don't think people associate what we eat with autoimmune disease or the way our joints feel. or cancers other than colon cancer. So everybody's heard, and of course people debate whether red meats, luncheon meats increase the risk of colon cancer. I believe they do. Animal products do increase the risk of colon cancer, but a diet based on animal protein, low fiber, low nutrient, low vitamin C increases the risk of lung cancer, as well as breast cancer, endometrial cancer, skin cancer. So what you eat, your immune system lies in your gut. When you have an inflamed gut microbiome, a dead and decaying gut microbiome, then you're putting yourself at increased risk of cancer. Nobody wants that. You can change that risk by changing your gut microbiome and changing what you eat. And I think when you add on to that the GLP-1 inhibitors that delay gastric emptying and delay colon transit even more, we're going to see more and more problems coming with the chronic constipation, chronic inflammation, more and more toxins absorbed, and there'll just be more and more side effects over time. The same thing can be said for bone screening and DEXA scans. There was a recent study that came out that looked at change over time, and unless there's about a 2.5 to 3.5% change, it's well within the error of the test. So getting yearly DEXA is just another way to expose yourself to radiation that does not predict or adequately represent improvement or worsening of the disease. The best thing that you can do, strength training and being mobile and keeping your mobility going. So instead of a calcium score or a DEXA scan or a CT angio, I would say give yourself a test by counting the fiber on your plate each meal and how much fiber you consume on a daily basis, and see if you can increase that to over 40 grams. I would give yourself a test to see, people have smartwatches. Most people don't look at the data over time. Are you exercising every day? Are you getting in over 10,000 steps? If you have diabetes, if you want to get rid of that, bump it up to 14 or 15,000 steps. You'll be well on your way to getting rid of your diabetes. And do a little mobility test. Can you do toe raises? Can you do a single toe raise? Can you walk on your toes? Can you walk on your heels? Can you do a squat to where your butt is close to your ankles and you're still looking up? Can you do a push-up? How's your hand grip? Can you do a plank for a minute? Can you do a bridge for a minute? Can you stand on one foot and put your clothes on? Can you touch your toes? Can you get off the ground without using your hands? Have you eaten a variety of fruits and vegetables today of all the colors of the rainbow? If you can pass those simple tests, then I would say your prognosis is excellent. If you're worried about what your peers are coming down with, don't be one of your peers. It is really cool to be an outlier and to not be one of the crowd that is sick, fat, and nearly dead. Tomorrow I'm going on a walk with the doc tomorrow afternoon for our members, so people in town can join me, and people on the Facebook can also join me for that discussion that are part of the practice. But that's one thing we do. Last week I went to the grocery store. We all went to Sprouts together to look at vegetables, talk about recipes, look at label and label reading and the different preservatives and oils and things that sneak into food that people didn't really know was there. We have mobility class every Monday that are put up on Zoom for our members, so they can do it live or they can watch it at their leisure on our members-only website, or if they're in town, they can come to the office and do it with me. That is what we're after in our practice. I'm not following people's DEXA scans. I don't care what your calcium score is. I want you not to have chest pain when you're running And we'll do that through a plant-based diet low in oil. If you have any questions about our practice, you can go over to the website, drdulaney.com, DOCTORDULANEY, and check it out. If you'd like to talk to me or you have questions, you can certainly email me at Jami, Jami, at drdulaney.com. If you'd like to talk about the practice, or not which branch of the practice or which membership level you'd like to join, give us a call. I'd be happy to talk to you about what might be a good fit. Some people come in at just having a membership to our website. Some just want dietary intervention. Some want coaching from a dietary standpoint and a consultation from a physician. And some want the whole shebang. So see what you'd like. We'd love to help you. Our idea is to get people off of medication and to get them eating a healthy diet and moving and being mobile all the way up and until the day they decide to move on from this earth, and they feel good until that day. Thank you as always for listening. If you like this podcast, share it with your friends. The more you share it with the friends, the more we might get more people plant-based, and you're not alone at the restaurant. The more we might get plant-based options at various places. I know I was at, I don't really ever go out when I'm in town, but I went to a restaurant here in town called Finn's, and we had wonderful vegan sushi this past weekend. So the more people that are plant-based and ask for it, the more chance you have of getting good options. I know our grocery store will make it for you if they don't have it out. You know, a plant-based sushi roll with carrots and avocado and cucumber. So don't be afraid to ask for what you want. Don't be afraid to order a pizza without cheese. Don't be afraid to send your salad back if it has cheese. Don't compromise your health because somebody wasn't paying attention. Thanks for listening.